All right, so we have an interesting episode coming up. I am here with Cynthia Thurlow, and we are going to talk all about intermittent fasting, a trend that's been showing up recently and has been all over social media. And I've gotten a lot of questions about it as it relates to weight loss and as it relates to controlling inflammation when it comes to joint pain and osteoarthritis. And so Cynthia is a nurse practitioner, the CEO and founder of the Everyday Wellness Project, and an international speaker with an amazingly 9.6 million views on her second TEDx talk about intermittent fasting, the transformational technique. With over 20 years of experience in health and wellness, Cynthia is a globally recognized expert in intermittent fasting and nutritional health. And she's also passionate about helping women find wellness through the healing power of nutrition and fasting, which I love because nutrition can be so powerful. And as a physical therapist, we have superficial knowledge of nutrition and controlling inflammation, which is why I wanted to bring you on. So thank you so much for being here.
Yeah, thank you for having me, for that warm welcome.
Absolutely, absolutely. And so first, I just kind of want to dive into, if whoever is listening and watching doesn't particularly know what intermittent fasting is, or maybe doesn't know the details about it. So if you could just kind of tell us a little bit just about what it is and maybe just some of the research that has been surfacing over the past few years.
Yeah, intermittent fasting is as simple as saying eating less often. And despite the media's efforts, they want us to believe this is new and novel. I remind people all the time, it dates back to biblical times. It is part of all of the major religions. And therefore, it's really aligned with our ancestral health perspectives. We wouldn't be here as a species if we were not able to go through periods of time of food scarcity. However, now insert the processed food industry and the way that our dietary patterns have changed over the last 50, 60 years, we now are a society that is overfed. And so, from my perspective, my whole background's in cardiology and ER medicine. I saw the worst of the worst of the worst of what happens when we are in an overfed state on a metabolic level. And so when I think about intermittent fasting, I always identify that it's eating less often. It doesn't mean not eating. It does not mean that you're starving yourself. You're just choosing to eat within a prescribed time period. And that could look very different for everyone. I know that your target audience is my target audience. And so when we're talking about women in perimenopause and menopause, perimenopausal women are still getting a menstrual cycle. And so I teach them how to fast for their cycle. And then menopausal women, average age here in the United States is 51. They're no longer getting a menstrual cycle. And so they have a little bit more flexibility with when and how to fast day to day, week to week, because we just don't have as much hormonal flux as we do when we're still in our peak fertile years, perimenopausal years, et cetera. So when I'm talking to women about starting intermittent fasting, I kind of have a stepwise approach about how to think about it. It doesn't mean that you don't eat. I think that's a really important distinction to be made. I do love that your focus is really on reducing inflammation. And a really good way to do that is to change your meal frequency. It's also to change your nutritional patterns, largely because we know there are some major inflammatory foods. I actually have a group that just started. And one of the things we do on week 2 is we put everyone through a Whole30. No gluten, no grains, no sugar, no alcohol, no soy, because we know these tend to be the most inflammatory foods. And what I find almost without question is if they do nothing else, and that is a lot, I will say that, we do nothing else, like eat less often and remove these inflammatory foods, women will say, oh my gosh, I didn't realize my arthritic symptoms were so improved. People that were playing competitive tennis and then stopped because they had so much arthritic pain in their joints, and they were told, oh, it's because you're in menopause. Well, no, it's actually the inflammatory foods you're consuming that are exacerbating some of these joint changes related to these hormonal changes. So in a lot of different ways, I've seen such tremendous improvement in symptoms that my middle-aged patients are experiencing just by changing their meal frequency. And if they want to ratchet it up another notch, really doing a broad-based elimination diet to at least tease out what might be exacerbating their symptoms.
Sure, absolutely. And as far as intermittent fasting working in collaboration with reducing inflammation and things like that, what is kind of a little bit of the science? Because I'm always down for understanding kind of why something happens. So why does kind of reducing this meal frequency change our bodies or produce these kind of positive symptoms?
Well, there are a few different things that happen. We know when we're eating less often, we are reducing stress on the mitochondria, which are the powerhouses of our cells. We know most, if not everyone over the age of 40 has some degree of mitochondrial dysfunction. And people say, well, what? I don't even know what that is. Why do I care? Well, we should care because over time, these powerhouses of the cell, they don't work as efficiently. So we have less energy. We're more prone to chronic disease states. I remind people when we're in an unfed state, there's actually this process called autophagy and mitophagy, where our body goes in and gets rid of disease disordered cells. This doesn't happen when we're eating constantly. So it allows our body to really take out the trash, get rid of the things that don't belong. We actually have a reduction in oxidative stress, which means that, again, this mitochondria are going to function more efficiently when we're in this unfed state. I think it's important to mention that most, if not all of us, the statistics from 2018 were 2018 UNC Chapel Hill study demonstrated that 88.2% of Americans were metabolically unhealthy and inflexible. And that translates into a degree of insulin resistance or type 2 diabetes. And so I remind people, when you are in a state of not eating and your body gets to a point where it's able to utilize either stored fats or sugar as a fuel substrate, it's going to allow your body to function at a much more optimal level. It's going to allow your body to, keep your insulin levels low. So you're going to have more energy, which is going to encourage people to get more physically active, which is going to translate into better managed glucose, which is going to translate into less joint inflammation. And so when we're looking at major scientific principles or major research, the autophagy is without question. Again, that occurs in an unfed state, reduced oxidative stress, reduction in inflammation. We know that it reduces specific biomarkers. So we know insulin resistance is tied in with high blood pressure. It's tied in with elevated triglycerides, with low HDL, high fasting insulin levels. And so I remind people that there are major pathological processes that go on when we have this chronically overfed state. As an example, average Americans 6 to 10 times a day are eating food or drinking sugar sweetened beverages. That doesn't give our bodies an opportunity to go in and utilize stored fuel as a fuel substrate, which means a fancy way of saying our bodies are no longer able to be as metabolically flexible. So when we're talking about fasting vis-a-vis inflammation, inflammatory pathways, there are specific inflammatory components that are reduced. We can look at interleukins, we can look at high sensitivity CRP. These are inflammatory markers. We can look at a lot of different things, homocysteine levels, all of which can be buffered and improved by eating less frequently. It is the byproduct of being in an overfed state that contributes to a lot of chronic health issues, a lot of chronic pain issues. And most of us aren't making those connections for our patients. We tell patients, eat your 3 meals a day, snacks in between, stoke your metabolism. And oh, by the way, eat a lot of hard, healthy grains, eat not enough protein, eat too many of the wrong types of foods. And by that, I mean inflammatory seed oils, vegetable oils. And oh, don't worry about your carbohydrate intake. I would flip that around and say, for a middle-aged woman, primarily animal-based protein, followed by high quality fats, followed by non-starchy carbohydrates. I'm not anti-carb, but I do remind women, as we are becoming closer and closer to menopause, we are putting ourselves in a state of less insulin sensitivity, which is going to mean we will be more prone to insulin resistance. Insulin resistance starts in our muscles. I'm not sure how much you talk to your people about this, but this is an important kind of distinction, that insulin resistance starts in our muscles. So what do we need to do as middle-aged women? We have to maintain and build muscle, which gets harder as we get older. We have to eat enough animal-based protein because the amino acid profile is superior to any plant-based proteins. It doesn't mean plant-based proteins are bad. It's just when you're looking at the hierarchy, we have to, lift heavy things, or at least be doing strength training several days a week. And we have to get high quality sleep. So all those things kind of come back to reducing inflammation in the body. And intermittent fasting is one of many strategies that can be beneficial for that.
Sure, absolutely. So it sounds like there's a lot of different benefits, and it all kind of cascades down into helping to prevent inflammation or reduce inflammation, at least, which we know that can be helpful for osteoarthritis and other chronic pain conditions. One of the things that, with kind of the uprising in the media of intermittent fasting, I know that there are certain windows, and I've talked to a few different clients who have kind of tried a few different things, from like day fasting to the 16/8 or whatever. If you want to kind of go into what are maybe some of the different windows that you've experimented with or that clients have experimented with.
Yeah, I mean, I think it's easiest to say, okay, let's look at a 16/8 because most people understand that's a 16-hour fast with an 8-hour feeding window with the understanding you're probably going to consume at least 2 meals a day. That's the basis of my book. And that's a lot of the research that I draw upon for the book. But obviously there are options beyond that. There are things like OMAD or 1 meal a day, which I don't recommend as a sustained strategy for women because there's just really no way you're going to be able to get your protein needs met. And my standard recommendations are at least 100 grams a day. So to give you some context of why OMAD is fine if you had a party the night before, you overate, maybe you're on vacation, maybe you overate that day, and you really just want to kind of get back on track. And then you can look at, longer fast, 24, 36. There's a lot of different variations, 36 hours, 48 hours. I mean, it goes up to 72 hours and beyond. And I think there's a law of diminishing returns. So if you are already lean, you don't need to be doing long fasts. I think that, Dr. Ted Naiman talks a lot about this, and I'm certainly a proponent. The law of diminishing returns is over that 24-hour marker. I'm not a fan of lean women doing a lot of long fasts. Now, if you have weight to lose, and that's the bulk of our population, then some longer fasts may be a good variation for you to upregulate autophagy. You'll get higher levels of growth hormone. If you fast long enough, you can impact stem cell regeneration and telomere length. And so it really is based on what are your goals, because I think that's hugely helpful. There are people probably watching this that do eat snacks and mini meals, and they're not particularly physically active, maybe because of pain or by choice. And that's not where they start from. They may start with, I have a very methodical plan in the book where I talk about these are the steps you need to move through to get to a point to even doing 12 or 13 hours of digestive rest. And even I kind of think the metric should be everyone that's an adult, not teenagers and children, but everyone that is an adult done growing should should do 12 hours of digestive rest every day, because it is that important to kind of allow for our body to work through digesting our food, getting our blood sugar back in alignment. But that's not what most people are doing. And so this can certainly be a kind of like, it blows your mind, even considering this. But I invite women, if you're watching this and you're dealing with chronic pain issues, to really consider giving your body an opportunity to have a rest. I mean, that's really what it's about. Just like we go to bed at night, put our head on the pillow, hopefully we sleep restfully for 7 or 8 hours, we get up in the morning. We want to give our digestive system that same opportunity.
Yeah, I mean, it makes total sense. And I'm glad that you brought up the kind of how to start, just because I think it can be really tempting to kind of take some of this information like, oh, maybe if I fast for 72 hours, I can have all these benefits. But likely that's probably not something to jump into, and your body may not be adjusted to that, or it may not kind of produce the results that you had just mentioned. And kind of segueing into that, I did want to kind of talk about maybe some people who wouldn't be appropriate for intermittent fasting, or maybe some considerations as to kind of what things to look at before kind of embarking on any sort of longer fast.
Yeah. And I think it's really important that people understand that if you're pregnant or breastfeeding, if you're growing a human or feeding a human, it's not the time to intermittent fast. And there's a lot of good research to support this, although there are a lot of fit pros on social media who would like to think otherwise. Obviously, children and teenagers, people that are still growing, absolutely not an appropriate methodology to utilize. I do know there's some research going on with very morbidly obese children that have things like non-alcoholic fatty liver disease and have diabetes in a controlled clinical setting, that they are using some degree of carbohydrate restriction and mealtime restriction, but that's in a clinical environment where they're being very closely monitored. I would say anyone that has a chronic disease. So if you have diabetes, you have high blood pressure, you see a kidney doctor, you see a pulmonary doctor regularly, let them know. It's not a contraindication, but you may need a reduction in your medicine. If you are insulin resistant or diabetic or have high blood pressure, those are all mediated by insulin, including the blood pressure piece. You may need a reduction in medication. So you may want to be checking in with them just so they can be monitoring your blood sugar, monitoring your blood pressure, just to make sure that you don't need a change in your medication. Beyond that, if someone's frail, and frailty can occur at any age, I know you and I both know that. I used to say sometimes I would have 45-year-olds that were more frail than my 80-year-olds. But if someone's
Exactly.
frail and has the dwindles, they're not very physically active, maybe they're not aware of, when their blood sugar is low, those would not be the people they sound, actually, they more often than not are malnourished. And so that's a whole separate situation. But in most other instances, I think it's completely reasonable to consider utilizing this as a strategy. And in fact, I've gotten more and more outspoken about it because I'm so frustrated that we continue to pass along such terrible dogma to our patients, which is becoming harmful. I mean, this whole concept of my plate, if you look at my plate or even look at the old, USDA food guide pyramid, it's completely the opposite of what we should be doing. And so is it any wonder our patients are confused and they're continuing to perpetuate bad information? Just telling people not to eat breakfast freaks everyone out. I'm like, I promise your body is designed to fuel itself in the absence of food. I promise. It's really the unusual person who can't tolerate that. And there's ways to work around. Someone tends to be hypoglycemic or they tend to have blood sugar dysregulation. It's like there's a million ways to work around that. It just means it may take you a little longer to get to a 16-hour fast, but it's absolutely doable. And we need to behave like our lives really depend on it. Like it needs to be at a level where this shouldn't just be, mockery in the media. It should really be most adults. And I certainly am aligned with a large group of physicians and other healthcare providers who are starting to speak out publicly a lot on this subject and really reminding people that we need to get back to basics. We've forgotten because we're such a symptom-driven medical model that we want to prescribe pills for symptoms when we really need to address the root cause. And so I think on a lot of levels, when we're talking about these kinds of things, we just have to get back to basics. We don't have to make it complicated. The more complicated we make things, the less likely our patients are going to be able to follow through because lifestyle changes are hard. They're not meant to be easy. I always say it was much easier to write a prescription than it was to sit down and counsel someone about, okay, let's try to get one more hour of sleep, or maybe let's remove this inflammatory food, or maybe just to have 12 hours in which we eat. It blows people's minds because they have to change things they do day to day, which is so much harder than just popping a pill.
Absolutely. And I think that the diet culture, has been very, very saturated. And I think that there are a lot of people out there that are confused. And then when they're confused, they just kind of revert back to whatever they feel comfortable with or whatever they have been doing in the past. And with the things like My Plate and things like that, those have been around for a while. And clearly the recommendations and things are not particularly working. And it could also be adherence as well. But we all know that obesity rates are climbing and health conditions are climbing, and it just becomes, osteoarthritis is one of the most common, joint conditions or musculoskeletal conditions, and it affects so many people. And I know, especially in my audience, people are always like, what do I need to eat? Give me exactly what I need to do. And it's not as simple as just a meal plan, like you were just saying. It can be just a few simple steps of just trying to reduce the meal frequency, which then likely reduces the amount of calories you're eating. Because I feel like sometimes, and I want to kind of get into the intermittent fasting, some of the myths around it, but I know that probably sometimes when, somebody maybe had fasted for 16 hours and then kind of has almost like a binge in their 8-hour window, which then maybe could lead to some not great results or not kind of seeing the benefit. So with that being said, what are some of the myths around that? And also, how do you kind of structure maybe the feeding window of kind of how to set that up and maybe how to prevent something like a binge?
Yeah. So let me address the binge question first. When someone binges, it means they've overfasted, meaning whether they aren't careful about where they are in their menstrual cycle. Let's say that it's the week before they start bleeding and they're really struggling with pushing themselves to 14 hours and then they binge. So first things first, when you binge, it's your brain. So you have your amygdala, which is your reptilian brain, overriding your prefrontal cortex, which is your thinking brain. And it's this food scarcity. It's like an SOS is going on in your brain, off in your brain, and that can lead to binging. So binging shouldn't happen if you are not over fasting. The other thing is you have to fuel your body properly. Fasting always goes as follows. When you break your fast, it's either protein, with a healthy fat, or it's protein with a carb. That's it. You never have carbs by themselves. You never have fats by themselves. You want to always, always, always break your fast with some protein, because that will be satiating. That will send off neurochemical signals in the body, specific hormones that will tell you that you are full, you are safe, etc. Do I have people that have history of a binge eating disorder or anorexia and bulimia try to fast? It's never my first choice. Can they do it? Yes, but they generally have to be working concurrently with an eating disorder specialist who has then decided they are ready to begin fasting. So I want to make sure I say that.
Sure.
I didn't include that earlier in the contraindications. If you have a history of a disordered relationship with food, binge eating, anorexia, or bulimia, you have to proceed with caution. In terms of ways to prevent problems related to fasting, as I mentioned, you want to break your fast properly. You want to make sure that you're not over fasting. You want to know where you are in your menstrual cycle if you are perimenopausal. And that can start at 35 to 40. So if you're late 30s, you're already there, early 40s. I think you have to be cognizant of the lifestyle piece. So are you not sleeping enough? Because we know that there's research to suggest if you're getting less than 6 hours a night of sleep, you're going to get dysregulation in your blood sugar. You're going to get alteration in leptin and ghrelin signaling, which means your appetite and your satiety is going to be impacted. You're not going to crave broccoli. You're going to crave junk because your body's looking for a fuel source. Stress management, and that doesn't mean 5 minutes, 3 times a week of meditation. That means generally working day to day with some degree of enacting the special side of the autonomic nervous system, which is the parasympathetic, the rest and repose. The one allows you to digest your food, to poop, have sex, etc. And then I would think the other thing that really comes into play is understanding the differentiation. And I talk about this in the book, between clean fasting and dirty fasting. So clean fasting is when you are fasting, you consume black coffee, bitter teas, electrolytes that are not sweetened, and water, and you stay hydrated. And that's a really good thing. And if anyone says, I don't like plain coffee or bitter teas, well, there are polyphenols in both of those that not only help with appetite suppression, they also boost fat oxidation. And this is important because a lot of people come to fasting because they want to lose weight. And I remind them, take the benefits. I don't love coffee and I drink bitter tea because of the benefits. I put a straw, I cool it off, I brew it, I put a straw in it, I slurp it down, and that's how I take my tea. With that being said, there's a lot of myths. A lot of people think that fasting is starvation. I remind people that is absolutely positively not the case. You are choosing to eat within a specific window. You are choosing to eat. The emphasis on eat. You're just not eating all day long. And I think it can be very triggering for people who have maybe a binge eating disorder or have eating disorders, that all of a sudden it's very triggering for someone to tell them, I'm choosing not to eat. And then they're sitting around them and they themselves are eating. So kind of checking in with yourself to see where that goes. There are people that believe that you're going to die if you don't eat breakfast. And I'm here to tell you, if you look at the way we have evolved as human beings, we are primed to be able to go through periods of food scarcity. You will not die if you don't eat breakfast. Same thing as you're not going to die if you don't eat dinner. So I remind people our body is primed, if properly regulated, to be able to go in and use fats as a preferred form of fuel, as opposed to glucose. And then I would say, lastly, one of the common fasting mistakes is that fasting is bad for women. And this I find incredibly upsetting because there's just so much propaganda around this in particular, that it's dangerous, you're going to wreck your hormones. Well, in the very beginning, I was talking about sleep quality, not over exercising, anti-inflammatory nutrition, right types of sleep patterns. And if all those things are dialed in and you feel good, you have plenty of energy, then you can absolutely attempt to fast. What I find people struggle with is if they have, they recently got diagnosed with a thyroid problem. Well, probably not the time to add another stress to the body. Fasting is a hormetic stressor. It's beneficial stress in the right amount at the right time. A lot of people are so fixated on losing weight because of the toxic diet culture that we've grown up with, that they're like, I want to lose 10 pounds in 1 week. And if I don't, then it means fasting's bad. So I think you really have to be attuned to where are you in your menstrual cycle. If you're still getting a cycle, leaning into those lifestyle pieces, understanding that if you are just got a diagnosis of having a thyroid problem, probably not the right time to add an intermittent fasting. But if you were otherwise pretty stable, feeling good, then I would absolutely encourage people to consider, even if it's 12 hours of not eating, because the benefits from that are huge. In fact, I have a lot of women who don't want to change what they're eating, but they're willing to consider intermittent fasting for maybe, 13, 14, 15 hours, because they're so intrigued by the benefits that the next thing that happens once they capitalize on that and they feel good, then they're willing to start doing an elimination diet. Then all of a sudden, they're off their diabetes medications, they're off their blood pressure medicines, they're off their, chronic pain medication. And that to me is wonderful, because unfortunately what allopathic medicine has kind of evolved into is we are symptom management. That's solely how we work. And I think we're so much more complex as human beings. There's so much more to us than that I think we're really missing opportunities to help our patients.
Yeah, and I absolutely agree. And I think that just kind of the simple step of just going 12 hours. I mean, for sleep, most of us hopefully are kind of in that like 6 to 8 hour fast already. So just kind of adding in a couple of hours at night or a couple of hours in the morning, just to kind of see if we can start working up to that. And I think that that's a good start, because like we talked about, and like it's seen all over the internet, that just everyone tries to make things so complicated, eat this at this time, eat these two specific foods together, avoid this food. And it just becomes this puzzle that so many people are left to figure out and don't ever end up figuring out. And I wanted to kind of talk about, lastly, fasting and exercise, and kind of how maybe if exercising in a fasted state or exercising after you break your fast, or how can that fasting window kind of play with exercise?
I think this is very individual. I have always been someone who likes to work out in a fasted state. Even before I was fasting per se, I just felt better not going to the gym with food in my stomach. So if you're someone who works out in the morning and you are metabolically flexible, you can absolutely fast. There's all these concerns about, oh my gosh, I was told by my trainer I have to have 40 grams of protein before I exercise and 40 grams after. That's not the way our body works. It's within a 24-hour cycle. I've confirmed this with, muscle protein synthesis experts. That's really a 24-hour cycle. But if you're someone that doesn't feel good when you work out in a fasted state, then maybe you get up in the morning, you have a little bit of bone broth. Maybe you have a small piece of fruit. Maybe you have some rolled up turkey and, a tart apple while you're going to the gym. I would encourage people to experiment. Do I think it's harmful? No. But what I always get concerned about is, especially for perimenopausal, menopausal women, can you get your protein in your feeding window? So if you've got an 8-hour feeding window and you get 100 grams of protein in, great. And really it should be 1 gram per pound of ideal body weight. So if you're supposed to be 140 pounds, really it's 140 is what you're working towards. So I think that it's important for people to understand that there's a little bit of experimentation that is helpful. If you are going from being a standard American diet eater, you're a couch potato, you're very physically sedentary, you're probably going to feel crummy trying to work out in an unfed state, because your body can't tap into those fat stores for energy. It's just burning glucose, which is incredibly inefficient. And it may be that you are going to have to slowly open up the opportunity over time, once you are fat adapted, to be able to exercise and do so in a way that you feel good. But it always goes back to hydration, electrolytes, really leaning into what your body is telling you, understanding that, from the day you start bleeding up until ovulation, estrogen is your superpower. That's the time you can push those workouts, longer fasts. And then after ovulation, the luteal phase, you may have to back off in intensity. You may not be able to do those longer fasts. And so it's just really important to lean into our physiology and not feel like we have to apologize for it.
Absolutely. And I think a lot of it just comes to body awareness, just kind of paying attention to how you react to certain things and how your body responds and just how you feel. And it may not be perfect all the time. You may not hit that certain fast every single day, but it's kind of the flexibility and being able to adapt, which goes right along the lines of osteoarthritis and dealing with chronic pain, just being aware of how your body's responding and be aware of how your body feels. And then we can kind of go from there. It's not some strict, rigid schedule like you've been mentioning. It's very flexible and you can adapt based on how you're feeling. And I think that's really important, just because we have to give ourselves some credit. We don't have to be perfect all the time, but just kind of starting with these simple steps, I think, can be really, really powerful. And if people want to find out about your book and about more about you and all of the good things that you talk about intermittent fasting, where can they find you?
Probably best place to start is my website. So www.cynthiathurlow.com. I have an amazing podcast called Everyday Wellness. I'm all across social media. So I'm on Instagram, I'm on Twitter, where be forewarned and a little snarky. I have a free Facebook group called Intermittent Fasting Lifestyle / my name. And you can find my book on Amazon, Barnes and Noble, Target, or your local bookstore. I do encourage everyone to try to find it at their local bookstore because they have really struggled the last 2 years. But yeah, Intermittent Fasting Transformation, IF45 is my book, and I'm so very proud of it. I've gotten really great feedback, and definitely can be beneficial for women in middle age and people that are dealing with chronic pain issues.
That is awesome. And I will put all those links down in the description or in the show notes if you're listening on the podcast. And I just want to say thank you so much. I hope that this is very helpful to you who are listening or watching, and just give you another perspective, open your mind to the options that are out there. And thank you so much.
Thank you.